Fox 61 News at 10 begins right now.
In health news tonight, joint replacement. An estimated 30,000 people have hip surgeries every year. Now there's a new procedure approved by the FDA last year that allows patients to stay active longer than with traditional hip replacement. Fox 61's Katisha Cosley takes us into the operating room to see the hip resurfacing procedure. And we should warn you, some of the video is graphic.
If I can just ask you to focus on this, you can see he's lost all the cartilage on the superior part of the joint, and that's literally bone and bone.
Danbury Hospital's Dr. Sanjay Gupta says this patient, whose surgery you're about to see, has severe arthritis in his left hip. He's a 59-year-old former cop and karate teacher, though he had to stop teaching last year because he was in so much pain. Let's get right to the operating table.
Needle, please.
Dr. Gupta first exposes the arthritic bone.
This is where he's almost bone and bone down here and down here.
Then he shaves off the bad portions, enough to cover the hip ball with a chromium cap. Next, he puts the metal cup the chromium ball will fit into on the other side into the pelvic socket.
In a traditional hip replacement, we would cut the head and neck here and throw that ball and neck away.
With hip resurfacing, doctors save more of the bone, giving the patient more strength and durability. Dr. Gupta says with this type of hip resurfacing surgery, this patient will be back to doing his martial arts almost immediately.
After about 6 months to a year, depending how he does, he can go back to martial arts, he can jog, he can jump. He can do whatever activities he wants to do.
He also says it reduces the need for additional surgeries and decreases the chances of hip dislocation.
Feeling better every day.
6 weeks ago today, 57-year-old Albert Vicio had the hip resurfacing surgery. This avid sportsman and mountain climber also suffered from arthritis for about 10 years. Not wanting to give up his outdoor activities, Vicio thought a total hip replacement would be too restrictive for him. Since his surgery, he's already walking about 4 miles a day on crutches and holding out the hope he'll be able to hit the mountains again soon.
If all goes well, there will be. I'm already researching some activities. Maybe back to Africa, maybe someplace else.
At Danbury Hospital, Katisha Cosley, Fox 61 News at 10.
The hip resurfacing procedure is recommended for adults up to 65 years old.